Dr. Erling, portopulmonary hypertension is a rare form of the disease. What are the characteristics of this particular form of pulmonary hypertension?
So what's unique about portopulmonary hypertension is that it requires the presence of portal hypertension to develop. It occurs in about 1/4 to 4% of all cirrhotics, and that's based on whatever data you look at. But there is a range, but you know that it's going to develop in a fraction of your cirrhotic patients. It used to be a contraindication to proceeding to liver transplant, but now we know that if we treat it aggressively, meet our hemodynamic goals, patients can be safely transplanted. The criteria for this condition is to have a mean pressure, just as all other forms of PAH, a mean pulmonary artery pressure of more than 25, and the pressure cannot be originating from the left side of the heart, meaning those left-sided filling pressures or the wedge pressure is equal to or less than 15, with a resistance that's high in the circuit, meaning a pulmonary artery vascular resistance or a PVR of greater than 250. And we calculate that by looking at the mean pulmonary artery pressure, subtracting the wedge pressure, and dividing that by the cardiac output. So the characteristics hemodynamically of this condition is very similar to all the other forms of pulmonary arterial hypertension, but we do require that patients have portal hypertension, and we can see that looking at the patient clinically. They have signs, symptoms, and imaging that are consistent with portal hypertension, or we can look at the hepatic venous pressure gradient and prove it that way also, which is an invasive way to test for portal hypertension.
So what would the current definitions be?
So the current definitions, so you have an individual with proven portal hypertension, and they have pulmonary arterial hypertension hemodynamics, a mean more than 25 on a right heart catheterization, with normal or low left-sided filling pressures, a wedge of 15 or less, and a high pulmonary vascular resistance, or that being 250 or greater. So those are the hemodynamic criteria in the setting of an individual affected by portal hypertension.
How easy is all of this to recognize in a patient?
Well, liver disease creates a situation of high flow, high heart output, as well as volume retention. So it gets very tricky to figure out hemodynamically. You want to assess your patient, get as much data points as you can. You want to optimize their volume status and then assess them by right heart catheterization in a setting which has experience doing those right heart catheterizations in these complex patients with multiple other comorbidities. And doing a right heart catheterization in these individuals is not low risk. These patients may be very sick. They may have coagulopathies. Their platelets may be low. So you really don't want to do this multiple times to figure out the answer. You want to do it right the first time, get all of your data so you can then implement therapy when you need it.
Excellent. Thank you, Doctor.
Thank you.